Hello, it's Dr. Chris Lauria from Roanoke Knee Solutions. Welcome back. I know it's been a little bit of time since we've had a discussion about knee treatment, and we had the holidays. Hopefully, everybody had a great Christmas and a happy New Year, and ready to get back started. A lot of people making some resolutions on trying to improve their health and wellness, and sometimes in the beginning of the year we get sore, and our knees play a role and our inability to reach some of those goals. So tonight we're going to talk about a topic, um, something called a meniscus, which we hear a lot of patients, a lot of people talk about meniscal problems, and I have no idea what that is. So that's what I'd like to discuss tonight. I'm going to give a couple more minutes, give some people to chime in and sign in and get on tonight's brief webcast over the next couple minutes. So just give everybody a couple minutes, a few people getting in here. So that's good. I guess some people get in, when they're ready. Usually start these right around 6 o'clock. I'm a little late tonight, but anyway, I get a lot of patients, a lot of friends, people I know, sports pickleball, that talk about a meniscal problem, or they have a torn meniscus or a damaged meniscus. And most people don't really understand what a meniscus is or what that means for them. The meniscus is an important part of keeping the structure and biomechanics of your knee moving properly. I'm just going to pull up this here real quick. Let's move it over there. This is the actual image of a knee joint. I hope you can see that. This is the upper leg bone called the femur. This is your shin bone called your tibia. And this is the knee joint. So, unique joint really has a couple of different spaces. It's got an inside, you're looking at the right knee from the front. It's got an inside joint space called medial joint space, outside joint space called the lateral joint space. And then you got your kneecap, which runs up and down the front of the knee. There's a joint behind that. You have different structures that hold the knee in place properly. On the inside, you have inside and outside, and in the middle, you have something called a ligament. And this big structure here is called the medial collateral ligament. And then you got the lateral collateral ligament around the outside here. And then running through the knee, which we hear a lot of, are two ligaments, one called the posterior cruciate ligament, and then up front there is called the anterior cruciate ligament, the ACL. That's what we hear a lot of. Uh, Athletes damaging that, tearing the ACL, and they get reconstruction for that. The ligaments of the knee are the big supporting structures that allow for proper motion and biomechanics of the knee joint. So my tie's a little messed up here. But they keep the knee in line, they keep it functioning, they allow for proper movement, and too much stress due to an injury, trauma, wear, and tear will cause a tear in the ligament. And that happens most of the time with the ACL and the medial collateral ligament due to athletics. There's also a small curtain around the inside and outside joint space called the meniscus. And like I said, it's a very thin, fibrous membrane. And I like to say it's like a curtain around that, which also allows for proper biomechanics, motion, uh, all these things to prevent the knee from moving too much. Well, the meniscus isn't as strong as a ligament, and sometimes we can put too much stress on the meniscus, which will allow a tear in the meniscus. What happens with that, it can be very painful, but also the way the knee moves after that is not normal. Sometimes the alignment structure is not normal because of a meniscal tear. Now, that can happen due to trauma or an accident, but also a degenerated knee, long-term wear and tear on the knee joint can cause a fraying or small tears in meniscus also. So that's what the meniscus is. It can get torn at different areas around the joint. It can get torn on the inside, the outside. There's different attachments that the meniscus has to the joint itself. Different areas can get damaged, torn, or broken down also. But when you have a meniscal problem, again, that knee is no longer functioning properly. It's no longer moving properly. There's no longer normal support, and there's no longer proper ability to move and have normal structure in the knee. So what do you do for it? Bad meniscal tears at a certain age, they will do surgery to clean out and repair the meniscus. You can do shots. to help with the pain. Physical therapy, they'll do things to strengthen the muscular around the knee joint to take the pressure off the meniscus, and to slow down the wearing out. Laser therapy can be effective in meniscal tears, and small ones. If it's a large meniscal tear, the laser is not effective anymore. But small fraying and small tears, laser can cause a response that helps to decrease inflammation, irritation, swelling, pain. It'll help with cellular replication, and sometimes the ability of the body to heal a small meniscal fraying or those type of things. And that's a common non-surgical treatment to help with a meniscal tear if you're not a candidate for surgery or any of those other treatments. So hopefully through this you've understand what a meniscal tear is, okay, what the meniscus actually does, and the proper treatment for that. We do a consultation if you've got damage in your knee, pain, numbness, the knee is popping and moving a lot. We're able to do an examination to determine if it's a degenerative problem or there's a meniscal tear. The only way you can truly tell if there's a meniscal tear is to get an MRI, which will diagnose which part of the meniscus is affected, how severely it's affected, and what would be your treatment options for that. So during our consultation, we would examine the knee, possibly recommend some radiology, x-rays, or MRI to determine the extent of the meniscal damage and whether or not you're a candidate for class 4 laser treatment to help with the symptoms you're getting for that. So what I suggest you do if you are dealing with some kind of meniscal problem is you can call our office to set up a complimentary consultation at 540-210-1445. The staff will set up a consultation with me. We can examine your knee joint. If you've already been diagnosed with a meniscal problem, I'd have to review your x-rays to determine if the laser treatment can help you in your case, or if it's too bad of a tear that we can't help. But if it's something we can work with, class 4 lasers very, very effective in helping with the symptoms of the meniscal tear, and then we do other therapies and exercises to try to help strengthen the knee, and it's all non-surgical. So if you're interested in do that, just call our office at 540-210-1445. Tell them you saw this podcast and you're interested in setting up a consultation to see if you're a candidate for the knee pain laser program that we offer. Okay, so hopefully this helps answer some of the questions for you. Again, if you have topics that you would like discussed, you can call our office. You can email us at info@roanokedisccenter.com and submit those, and I'll cover those on one of the next live broadcasts that we have. Okay. Again, it's Dr. Chris Lauria from Roanoke Knee Solutions. Happy New Year, and hope to see you in the office soon. Thank you.